Hi, my name is Tammy Smith, and today I'll be working with Bob. Bob contacted me after a motorcycle accident. Hi, Bob. It's nice to meet you.
Hi, Ms. Smith. How are you? It's very nice to meet you as well.
Thank you. Can you tell me what brings you here today?
Yes, ma'am. On July the 4th, me and my wife returned home from a beautiful vacation in Northern California. Laid down that night, had a good night's sleep. Got up the next morning, went out in the garage, opened the garage door. Wow, it's a beautiful Friday morning. So at that time, I decided I needed to run some errands. So I decided I'd ride my motorcycle. Hopped on my motorcycle, went and got my hair cut, went to the ATM machine, got a little money, feeling good about myself. My main objective was to go out to where I work and get some papers for the start of work the next week. That was to return back to work off vacation that following Monday. En route to the work site, I had a motorcycle accident. So I found myself laid out in the middle of the street, motorcycle on the side of the road, and I'm hurting, experiencing a whole lot of physical pain.
Wow, it sounds like you were shocked. Your whole world was turned upside down. You went from a state of serenity to quite a bit of trauma.
Yes, I suffered a lot of physical pain, as you can see. The scars have healed eventually, but I also suffered a deep rotator cuff on my left shoulder, bruise. It's deeply bruised. And with that pain came emotional pain as well. You know, you find yourself not sleeping at night, you find yourself being impatient, anxious, doubting, ready to, wondering if you're going to return back to full physical state as you were, and it's very troubling for me right now.
Okay. So it sounds like what I'm hearing is your recovery has been pretty difficult for you.
Yes, it has. It's been rather difficult for me. The emotional. The physical scars will heal in due time, but the emotional scars. You find yourself, especially at night. I've been sleeping maybe 2-3 hours a night, and I wake up, and with the physical pain there, you suffer. Well, why me? What did I do wrong? Was it my fault? Was it my mistake? And it makes you just feel very uncertain, inadequate, and it's just troubling.
So this accident has caused you to question quite a few things?
Yes, it has. It really has caused me to question quite a few things. Will I ever return to normal? Will I ever be able to do my job, completely like I had in the past? It's caused a lot of stress, a lot of mental stress. And, I've gone back to work. Initially, I sat on the sofa for 2 weeks. My wife helped me to, clean my wounds. She took care of me, helped me take showers, keep me clean and dressed. And I've returned back to work, like I said. Fortunately, I have a job to where it's not physically demanding, because now I'm working light duty, which means I can't go outside and climb vertical ladders, which is a part of my day-to-day activity. I'm very blessed in that way. I'm very blessed in that way. But the emotional part of it is where I wanted to come and talk to someone, professional, just to express the way I feel, and I just want to get over this. I don't think I'll ever get over it completely, but we'll see in due time.
What I'm hearing is some anxiety that is a direct result of the accident. You feel anxious over what has occurred and it's affecting your everyday life.
Yes, and along with what causes that anxiety, I believe, is impatient. I have very little patience, thinking that it's like a finger cut. I cut my finger today, and 2 weeks later, that finger's back to normal. Whereas that shoulder, it's hurt. It's a real major injury there, and I'm trying to avoid having surgery on it. So I went to an orthopedic specialist, and he referred me to take therapy. I've been taking therapy treatments, and those are working out fairly well for me.
Okay. What's the prognosis? What do they anticipate? How quickly do they anticipate you'll heal?
I've read and studied some, and the doctor said it varies from case to case.
Okay.
But normal rotator cuff injuries of this nature takes at least 6 to 8 months to heal completely. And I can tell by day-to-day activity, it is getting stronger, but it's just going to take a long period of time.
So you're not at 100%, but you're working towards getting at 100%. You feel that you will be able to get to 100%?
Yes, ma'am, in due time. Due time. I just have to, realize that, the body's physical. I mean, it takes a long time for it to heal, and I'm not a spring chicken any longer. I'm 52 years old, so it's going to take a little while for, those muscles and whatever bruises are in that joint to heal.
So are you able to, you mentioned that it's affected your job. Are you able to work around your injury at work?
Oh yeah, very easily because I have an option. I can work outside in the field, which is physical, which will require me to use that left arm more, or I have an inside option, and that's why I'm working now. I'm working inside to run the computer that operates the unit that I'm assigned to. So that's a blessing in itself to have that option. So, and it helps me a lot emotionally to be able to get off the sofa and go back to work.
Okay. So you are feeling better about things. You feel better about things because you know that you are able to retain your job and that things will probably improve if you continue the physical therapy.
Yes, ma'am. That's exactly right. And in due time we'll go back to the doctor and hopefully he'll release me. And then I have to clear the doctor at medical, and at that time I will be able to return back to full duty at work.
Okay. That sounds like a plan. It sounds like you have something that you can work towards. Do you feel confident that you will be able to move forward?
Eventually, like I said earlier, as the physical scars heal, I think the emotional scars will heal. And as that physical feel better, it will help me mentally to feel better as well. Even like as today, I realized driving here today, I can actually turn the steering wheel 360 degrees to the left and to the right without any pain. So that's a big positive in itself.
Okay, so you're doing your part to heal your body.
Yes.
You are not allowing yourself to feel sorry for what has happened, but you're trying to push yourself forward as quickly as you can.
And that's right. That's exactly right. Because when I was sitting down on the sofa, you sit there and you feel sorry for yourself. You say, why me? What did I do wrong? Or did he see me? Or body this, body that? And it makes you feel very less adequate. Whereas when I got up and went back to work, that's a big motivator physically and mentally. So, and now here I'm realizing that I can drive better. Some of the pain is starting to go away. And it's a big positive.
So the time you spent at home, you felt inadequate. You felt like you were not good enough and that you couldn't accomplish what you wanted to because you were at home and you weren't able to work.
Exactly. And I couldn't even do the day-to-day activities like mow the yard, bring the grocery into the house for my wife, wash the vehicle, or any of that. Couldn't even sweep the floor.
And that is all important to you.
Yes, it is.
Yes.
Yes, it is.
Okay.
Yes, it is.
Well, can you tell me more about, the emotional impact that the accident had on you? You mentioned that you weren't able to sleep well.
Yes, it's not a nightmare, but it's a nag because you wake up in the middle of the night. Why me? What did I do wrong? Why me? What did I do wrong? Will I ever be normal again? Will I ever recover from this?
Do you feel a sense of guilt? I'm detecting, and you can correct me if I'm wrong, do you feel a sense of guilt that you had the accident and that it's affected every part of your life?
Well, it's not necessarily guilt, but it's a why.
Okay.
For lack of a better description, it's not guilt, it's a why.
And you're questioning
Why
God?
did it happen?
Who are you questioning?
Me, myself.
Okay.
What did I do wrong? Why
Okay.
did it happen? Why did this happen to Bob?
Okay. Okay. What I'm hearing is confusion over what's occurred. You know what has occurred, but the aftermath has brought some confusion into your life.
Right. You're exactly right, ma'am.
Can you speak more about that?
Well, it's confusing because it takes you away from your norm.
Okay.
It takes you away from that norm. And I live a pattern life. You get up in the morning, brush your teeth, wash your face, go to work, come home, kiss the wife, kick the dog, eat dinner, take a shower, and go to bed.
So this accident has taken you out of your normal routine,
Yes, ma'am.
and it's been very difficult for you.
Yes, it has.
Okay, I understand. Bob, I appreciate you talking with me today, and it appears that Bob is moving forward. He's just dealing with some emotions that make him feel as though he is inadequate, and he's not been up to par since he had the accident. However, he does have a plan, and that's continuing physical therapy that should bring him around. Thank you.